going to get started. Folks will continue to join online, and then there are folks joining in person as well. And so thank you again for joining us this evening. My name is Mary Jo Katras, and I am with University of Minnesota Extension. And I will be facilitating the forum this evening. So we're just going to do a little housekeeping here before we get going. If everyone could mute themselves, that would be great so that everyone can hear. And also for those that are online, you may ask questions in the chat throughout the presentation. And then when we get to our question and answer period, you can unmute and ask questions as well. For those that are in person, you will be given a index card where you can ask a question, and then those will be collected during our question and answer period as well. So the purpose of our forum this evening is to provide COVID vaccine information to support you and your family and your community as a whole to make an informed decision about the vaccines. So for the first 30 minutes this evening, we will hear from our panelists, and I'll introduce them in a minute. And the second half of our forum, the second half of the hour, will be to ask for you to have the opportunity to ask questions. And so please, as you are listening to the panelists and questions pop up, jot them down if you're in person, or pop them in the chat, and we'll keep track of those. If there's questions that we aren't able to answer during this next hour, we will keep track of those questions and send them out and get them to folks after the webinar or after the forum, so that we make sure that we answer your questions. And we want to make sure that everyone has a chance to have their voice be heard. So I am going to, let's see, I think I am going to turn it over. First we're going to introduce our panelists. I'm so sorry. So tonight for our panelists, we have Grant Anderson from the University of Minnesota Duluth College of Pharmacy. We have Lauren Lundstrom from Fairview Masaba Clinic. We have two pharmacy experts, Julie Anderson and Anthony Grand. And we have our county public health expert, Ray Job. And then we have Jessica Marcourt from Lighthouse Center for Vital Living. And just to give you, I didn't say this before, but you've gathered this probably, that this is a hybrid approach that we're taking tonight. So we will have some presenters that are in person presenting, and you'll be able to see them on the screen. And then we have some folks online that will be presenting as well. So just to kind of give you that lay of the land. So, okay, well, we are going to start off tonight with a video, a story that Julie Anderson, one of our pharmacy experts, is going to share about her experience with COVID-19.
You have to be in this?
Hi, my name's Julie Anderson. I am a local hospital pharmacist on the Iron Range. I was born and raised in Virginia, Minnesota, and I'm sharing my COVID story with you tonight. It starts back in October 2020. My husband developed a low-grade fever, and it lasted 12 hours, and that was about it, with a headache. He tested positive for COVID, followed by myself and our two youngest daughters. We handled it pretty much like the normal symptoms with fever, aches, loss of taste and smell, but it really wasn't that awful. None of us had any issues with coughing or breathing, no infection in our lungs, and it was pretty smooth. Fast forward to January 2021, and I was able to get vaccinated. So I did that. My side effects from the vaccine were really just some aches, and I was really tired. I needed to go to sleep early that night and the following day, but I was able to work, and it really wasn't too big of an issue. Towards the end of spring, my husband was able to get vaccinated, and things seemed like they were headed back to normal. We were able to take a family vacation. Things looked bright in the COVID world. And then mid to late summer, I started seeing people my age hospitalized with COVID. I'm in my late 30s, and that surprises me when I see an age with somebody hospitalized that young. On top of that, there was 2 people that I knew personally that got breakthrough COVID, which is what we call getting COVID when you've been fully vaccinated for it already. Both people handled it fine, but it was pretty concerning that maybe this return to normalcy wasn't going to happen. At that time, I reached out to a close family member and just kind of encouraged that person to think about getting vaccinated because there were people our age in the hospital. The next week, our nanny tested positive for COVID, and she had been around our youngest daughter. And probably about 12 days after that exposure, our youngest daughter got a runny nose, and she had already had COVID. So I really didn't think anything of it. It was a full week or more, and all of a sudden this cough started. And it wasn't just a dry cough. Like you could hear in the breathing and the coughing things in her lungs. She handled it pretty well, but I think the cough lasted almost a week. We had a wedding that weekend, and I didn't want to be the mom that showed up with the kid hacking. I wanted to at least be able to say that she tested negative for COVID to kind of put people at ease. And so I did get her tested, and she tested positive. So everyone else had tested negative after that, but my daughter that had already had COVID in October is now fighting it again in August. The following week, the family member that I had encouraged to get vaccinated ended up testing positive, and that person and their significant other both ended up hospitalized with COVID pneumonia. And they were both in the hospital for around a week. It was pretty scary for everyone. Really hit close to home for, I think, the first time for me, despite having it in our house. They missed a lot of work, and it was surprising for me to see the difficulty in breathing after that person came home from the hospital. Even just a walk to and from the kitchen back to a chair and having to try and catch their breath, it was pretty scary. They're doing fine now, but my viewpoint kind of changed at that point on before, not really that concerned if people had gotten vaccinated or not. Like, everybody do your thing, and it wasn't that severe. You could probably get through it, to now being genuinely concerned for people's health if they aren't. I don't know how I feel about kids getting vaccinated. None of my kids are old enough to have that thought even occur to me yet. So I'm really excited to hear about some of the information tonight, and I wish you all the best.
Thank you, Julie, for sharing your story. Now I'm going to turn it over to Ray Jobe, who is going to share, who's from St. Louis County Public Health, and is going to share some data with us.
Yeah, thank you. And welcome everyone that's listening and on the call. I'll wait for Mary Jo here to advance the slides. Perfect. Okay. So all this information that I'm going to share with you, it can be found on the county website. Everybody has access to it. The URL is probably not super easy to remember. So if you just type in St. Louis County MN and go to the website, you will find a COVID tab. And then if you follow that, just go to the COVID dashboard and you can get access to all this information. Go ahead and advance the slide, Mary Jo. Perfect. I'm not going to spend a ton of time on this. There's a lot of information, a lot that you can glean from it. So I'm just going to kind of try and hit the highlights here. Because we are talking about the 0 to 19-year-olds, most of the information is going to be centric to that. So in this graph, might be difficult to see on your screen. I know it's small. Also might be difficult if you're in person, but We've had 1,461 cases in the 0 to 9-year-olds, and this is in totality. So since the beginning, we've had 3,191 cases in the 10 to 19-year-olds. So for a total of 4,562 cases in that 0 to 19-year-old age group, which roughly equals 19.2% of all cases. Do you want to advance this slide, Mary Jo? Perfect, thank you. So this is just a further breakdown, and this is a breakdown a little more centric to your region, so the Central Southwest. A lot of information on this one as well. So just over 26.9% of total cases in that 0 to 19 age group have occurred in this 40-day snapshot here, and that's across the entire county. Of that 26.9%, 47.9% of those cases during this period have been in this Central Southwest region. 48.6% of total cases over the period of 9/5/21 to 10/10/21, so essentially since school has started, 48.6% of these cases have been in the Central Southwest region. And during this 40-day period for this region, 83.4% have occurred since the start of the school year. And go ahead and advance the slide, Mary Jo. Perfect, thank you. This is a look at pediatric admissions by month. You'll see it's kind of sporadic. And one thing I should note as well, this information is somewhat incomplete. So that first slide where you saw the totals, that's probably the most up to date. Some of these other ones, it just depends on when that data is released to us. So just keep that in mind. If anything, those percentages would increase rather than decrease. So for pediatric admissions, 20% of pediatric admissions have occurred from in September and December. So that's 11 out of 55 cases. That number could go up. I'm not entirely sure when that information is released to us. So just something to consider here. Go ahead and advance the slide, Mary Jo. And then, so this here, just pediatric admissions by age group and by region. 27.7% of pediatric admissions have been in that 0 to 12-year-old population. And then 50.9% of pediatric admissions have been from the Central Southwest region. Go ahead and advance the slide, Mary Jo. And I believe this is the last one I wanted to touch on. And I apologize for how quickly we're going through this, but just want to leave lots of time at the end for questions. So this is a look at hospital admissions and ICU admissions. 17% of hospital admissions have been in September and October. Again, that is, oh, well, that's unfortunate. 17% of hospital admissions have been in September and October, and then 12% of ICU admissions have been during that same period in September and October. Those numbers could go up. This is another one of those data sets that just isn't complete yet. We're not all the way through October, so we haven't received all that data yet. That's kind of a brief, in a nutshell, on that data. Go ahead and advance. I think that's my part for the time being.
Perfect. Thank you so much. And just to let folks know, I'm going to try to figure out if you saw a black screen or black box on the top. We're going to kind of fix that, but just to let you know that these slides will be made available after the forum as well. So, I am going to turn this over to Grant Anderson, who is going to talk a little bit about the science behind the vaccine.
All right, thanks, Mary Jo. Yeah, your black box is still there. Guess we'll have to work through that. That's okay. And thanks, Ray. You look like a Halloween person there when the lights went out with your white face. Anyways, my name is Grant Anderson. I'm from the College of Pharmacy in Duluth, University of Minnesota Duluth College of Pharmacy. And I'm going to talk a little bit about the vaccines, a little bit about the science behind the vaccines, and also COVID-19 infections themselves. So we reached a really unfortunate milestone in the U.S. here about a month ago. Some of you may have seen this. 1 in every 500 American citizens has died of COVID-19 in the last year and a half. That's a staggering number. What's even more staggering, 1 out of every 35 U.S. citizens over the age of 85 has died of COVID-19 in the last year and a half. That's also an incredibly staggering number. And we know that this is very much this infection with SARS-CoV-2 and the disease COVID-19 is very much hitting our elderly population. But Mary Jo, if you could advance the next slide. But it's not only the elderly that are afflicted with this particular infection. So this is data that comes from the CDC just yesterday, and it shows the cases on the y-axis. You see the incident cases per 100,000 persons in the U.S. from the beginning of the pandemic until the present, and you see this 4 waves that you see here you see of infection. We're in that 4th wave now in October, past this dotted line on the right-hand side. Is this me or is this you, Mary Jo?
What are you referring to?
Permission to use an application, install something.
Must be.
Is that us? That's us. Okay. So this is the Delta variant that we're talking about in October. And what you see, if you look at the colors of these lines, it represents different age groups in the U.S. The yellowish colors, those are the younger people in our country. So 0 to 17 years of age. And what you see is in the earlier stages of the pandemic, these are the people that were infected less. It's the older people that were infected more. But now look at what's happened in September and October of 2021. We see it's flipped. So the younger people now are the predominant cases that we're seeing of COVID-19 in the country. And interestingly, this age group as well, the age group of the 30s to 40s, likely the parent population for these children. We've seen a real change in who is getting infected in our country as we enter into this new phase of the pandemic. Next slide. So we know that this virus can be transmitted from one person to the other through the respiratory droplets. You can get them through contaminated surfaces with large droplets, but mostly you get it by breathing in the droplets, the aerosols and other respiratory droplets that are spread by someone who's infected, which is why we're wearing masks right now. Next slide, Mary Jo. And so to protect yourself from getting infected, we want to use our full armamentarium of protective measures. This includes keeping your distance from people. If they're infected, the farther away you are, the more air between you, the less likely you're going to get infected. Wearing a mask. We have data that show that wearing masks can help protect from spreading the virus or for receiving the virus yourself. And next slide, Mary Jo. And as pharmacists, which is where I'm working, the College of Pharmacy, we'd like to think that it'd be awesome if we had a drug that we could give to protect you from developing COVID-19 or protect you from COVID-19 once you had it. And Anthony might talk about some of these drugs later. We do have some drugs to treat the very severely infected individuals, but we just don't have those drugs at this point available to us. But what we do have, fortunately, are vaccines that are effective and safe for the prevention of COVID-19 disease. So what I want to show you in this slide, you don't have to look at the details, but if you look across the top, these are the steps that are taken in the production of vaccines. So from the beginning, when you just had the idea, I want to make a vaccine, all the way through the industrial production of vaccines that are going into the arms of people. Traditionally, this has taken a decade or longer from start to finish. For SARS-CoV-2, from the moment that this virus was first detected to the first vaccines going into the arms of individuals, it was less than a year. This is a remarkable accomplishment. And what this remarkable accomplishment has done, however, is made some people wonder a little bit about the safety of the process. Was this rushed? Did we go through all the correct procedures to make sure that this is a safe and effective vaccine? If you look at the bottom, what you'll see is that for SARS-CoV-2 vaccine development, all of the steps have been taken that we normally would take in the development of a vaccine. It's just that they were done differently. So some of the steps were overlapping, as you see here. There was a significant influx of money, your tax dollars, that went to these companies that were generating the vaccines so that when the vaccines were ready, were approved, they would be ready to go out the door. And what's not seen in this slide is really something that is probably underappreciated. All of these studies were taking place in the middle of a once-in-a-century pandemic, where millions upon millions of people were getting infected at the time the studies were taking place. So when they enrolled thousands of people in these studies, they very quickly became infected, unfortunately. But for the science, that meant that we could very quickly then, with that data that was coming in, we could very rapidly then determine if these vaccines were effective and over time whether they were safe. Next slide, please. So there are three different vaccines. Two of them, Pfizer and Moderna, are what we call mRNA vaccines. The Johnson & Johnson vaccine is what we call a non-infectious viral vector vaccine. So what all three vaccines have in common is that their working parts, previous slide, their working parts are really a gene that encodes for the spike protein of the virus. This is a cartoon of the virus on the left here. You see this sort of red projections off the surface of the virus. This is the spike protein, and this is the part of the virus that binds to the receptor on the cells that become infected. So if you mount an immune response, let's say antibodies against this virus, they're going to bind to the spike protein and physically interfere with the ability of that virus to bind to cells that it's trying to infect. That's how these vaccines work. And so to develop the vaccine, what was done was, this is the genome of the virus. A little piece of the genome that encodes for the spike gene was taken out. mRNA that encodes for this gene was produced and then put into a lipid droplet. So if you take oil and water and you mix it up, you have these little tiny droplets. That's exactly what these vaccines are like. You take the mRNA with water and sugar and salt, add some lipids to it, some oil, mix it up into tiny little droplets and inject it into your arm. And those tiny lipid droplets fuse with the membranes of your cells and dump this RNA inside the cell. It gets converted to protein. Your body recognizes this protein as foreign, and that's how you get an immune response against it. For Johnson & Johnson vaccine, it's a little different. It's a virus vector that is not infectious to you. It's an adenovirus, it's called. And your cells in your arm will take up that virus, but the gene is within this virus. The spike gene is within the virus. The spike gene is produced, the protein is then produced, and you have an immune response against it, just like for the RNA vaccines. So this is how these vaccines are formulated and work. They're not viruses themselves. You can't get COVID-19 from these vaccines. They're shown to be highly effective and safe. We're going to talk about that in a few minutes. They're effective against viral variants, like the Delta variant, for example. And especially the RNA vaccines are very easily modifiable. And I think we're going to see that into the future if we have this coronavirus persist, that there might be some changes to the vaccine that's easily made. Next slide. And so the last thing I want to do is give you a 1-minute immunology 101. So why do you need multiple doses of these vaccines? And we now know that we need multiple doses of all of the vaccines, including the Johnson & Johnson vaccine. Well, that's because our body's immune system reacts differently to the first time it sees a virus or antigen versus the second time. So here we have in this particular cartoon, the first exposure to the vaccine. You see this induction of an immune response. Here we're measuring immunoglobulins, but there's also T cells are called that are induced as well. And you see this increased amount of these responsive antibodies, but they decline pretty quickly. This is over the course of only about a month. They don't persist, but if you induce with a second exposure to that antigen, so a second dose of the vaccine, you get this massive boost to the immune response. There's a lot more antibodies are produced, and you also have something called memory that's induced. This memory then allows your body to react to this virus if it sees it again months and perhaps years down the road. What we now know is that these vaccines start to wane in their effectiveness over time, especially for people whose immune responses are compromised, like elderly people. And we now know that for these people, we're recommending boosters. So a third shot that will, again, give the stimulation that we see here in this right-hand side of the slide. So that's your vaccinology and immunology 101. And I'll turn it over to Lauren next.
Hello. So I'm Dr. Lundstrom. I'm one of the pediatricians at Fairview Masaba Clinic, and I'm here to talk about who can have the vaccine, especially in children. Next slide. Next slide. So as he was discussing, these are the 3 vaccines that are approved in the United States. You have Pfizer, Moderna, and Johnson & Johnson. I'll quickly go over these. For Pfizer, that is the one that is approved at the youngest of age. Right now, it's currently approved for 12 years and older. It is fully approved by the FDA for 16 and up, and then it has emergency use for 12 and up. And then pretty soon it'll be 5 and up, which I'll get into in just a minute. That one is a 2-shot series, 3 weeks apart. And you're fully vaccinated 2 weeks after your second shot, just like the other ones. Boosters has also recently been approved within the last week. So they are recommending boosters if it's been greater than 6 months after the second shot, especially for the immunocompromised, like what he was saying, and the elderly. The Moderna is only approved for 18 years and older. They are trying to get approval for younger, and that is still in process. If you remember, the Moderna came out after the Pfizer, so they're about a month or 2 behind Pfizer as a general standpoint for their approvals. They are also a 2-shot series given about a month apart. And then, of course, it's 2 weeks after your second shot that you're fully vaccinated. Again, the boosters after 6 months. Johnson & Johnson is the only one that is a 1-shot series, but we are finding that it is recommended to get that second shot or to get a booster for this one. It has a little bit lower efficacy than the other 2, which Anthony can get into later. But this one is only approved for 18 years and older. And again, they say that you are vaccinated 2 weeks after your shot. Next slide. Another thing I'd like to add too about the boosters is that a week ago, they approved mixing and matching. So it has been shown that it is safe and effective to mix and match doses. So if you did get the Johnson & Johnson, you can now get other vaccines if you're one of those immunocompromised or high-risk people who needs one. So vaccines on the rise for school-age kids. This is where my job comes in. So yesterday, the FDA had a committee reviewing the possibility of approving the Pfizer COVID vaccine specifically for ages 5 to 11. This was an emergency use only approval. I watched a portion of it, but basically there was a committee for about 8 hours online yesterday, and they read hundreds of pages of Pfizer documents and data. They were CDC, FDA, both presented, as well as Pfizer. And then they had quite a large amount of presentations from both sides and all aspects of the community, from scientists, from epidemiologists, from personal stories, both for and against the vaccine. And so it was a really good committee where they really looked at all ends of the vaccine and its true safety and if it is right for our kids, ages 5 to 11. The vote as of yesterday was unanimous to approve the vaccine, indicating that it is safe and that the benefits outweigh the risk for the 5 to 11-year-olds. Now, this committee, although is approving it, it's not officially approved for the mass public. So we still need to have the CDC to meet, which they will meet, I believe, either November 2nd or 3rd. And then we also need to have the general FDA to approve as well. Once those 2 have approved, then they can start rolling out shots for the younger kiddos. As of right now, it's still for 12 and up. The vaccine that they tested on the 5 through 11 is actually 1/3 of the dose of the current vaccine that all of us as adults would have gotten. And he'll get into some efficacy, but it did show that it was very effective of 91%. Basically, Pfizer did a clinical trial of, at the end of it, it was about 4,000 kiddos in that age group. About 3,000 of them were vaccinated and about 1,500 were placebo, meaning they did not get the shot. And I kind of compared the 2 in terms of side effects and efficacy, and if someone got COVID or didn't get COVID, all that good stuff. So they found that it was very safe and very effective for our little ones. There have been no studies at all yet, or no profound significant studies for things younger than 5 years old. We're focusing just on the 5 and up for right now. And then I will send it over to Anthony, who's going to talk about efficacy and side effects and all that.
Hello, I'm Anthony Grand. I don't have any slides. I'm going to share just a quick little personal story, then I'll get into some of the topics that have already been covered pretty well. I'm a local hospital pharmacist on the Iron Range. I've been a COVID vaccine provider since our first doses of Pfizer kind of hit distribution. Myself and my team have been responsible for tens of thousands of COVID doses that have COVID vaccine doses for Pfizer and Johnson & Johnson that have made its way through different hospitals in the region. I think one of the most prolific things I remember during the distribution of the vaccine was during a vaccine clinic, one of the original vaccine clinics. Multiple people broke down into tears. As you know, Julie alluded to in her talk at that time, the vaccine was really thought of a way that the pandemic was for sure going to plateau and decrease, and life would go back to normal. We obviously know now it wasn't as simple and still have work to do. Like has already been spoken, the vaccines right now, we have 3 vaccines on the market: Pfizer, Johnson & Johnson, and Moderna. Pfizer, as Dr. Lundstrom alluded to, on November 2nd, will go through full approval through the CDC and the FDA. And if that is approval granted, we would expect that we would be able to start vaccinating as early as next week or the week after. Those doses of the pediatric Pfizer vaccine have been ordered by most institutions. They have not been shipped yet, and everybody is kind of anxiously awaiting those. As said, it's shown upwards of low 90% efficacy in children. Just in general, Johnson & Johnson, Moderna, and Pfizer compared to each other. Moderna has been known as the highest efficacy initially when taken through a period of 6 months, followed by Pfizer, and then a little lower in the high 80s by Johnson & Johnson with the singular dose. And then as we follow through time, Pfizer remains about 80% after 6 months. With Moderna, right about in the high 80s. For side effects, I think the important thing to think about for side effects with all the COVID vaccines is it's very common for people to develop site reactions, pain, itching, redness, some systemic reactions such as headaches, upset stomach, just feeling woozy, some moderate to mild flu-like symptoms. But it's very uncommon for people to actually have to seek medical attention after getting any doses of the vaccine, and that's staying true for the 3rd dose for boosters for adults who will be receiving those. Another thing in safety, as we talk about safety, people question the safety of the vaccine, and it's good to always question the safety of any medication you're taking. And Johnson & Johnson kind of provides us with a unique look in that the government shut down the emergency use authorization. And for a period of time, we weren't allowed to give Johnson & Johnson due to some stroke and blood clotting. And I think that's real important to look at when we think of the safety of COVID vaccines in general, because that was a vaccination, was effective, but they shut it down. They took a step back to make sure that it was safe and the benefits outweighed the risk. And now its production has started again. And we're, as of just recently, we're going to be able to give boosters of Johnson & Johnson. So it's always something to think about, that they have been very diligent in the vaccine reporting adverse events, and all of these vaccines are continuing to be watched and monitored for different events that may occur.
Thank you, Anthony. Now we are going to, I'm going to turn it over to Jessica Marquardt. Let's see, you wanted to unmute and share your screen.
Yeah, hi. So I am going to share the screen for the website. This is an incentive program that's fairly new. Let me share here. Okay, so to get to the website, you would go to the Minnesota.gov website, and then you can kind of see these tabs here. There's a home tab and then vaccine rewards, and then it's a program called Kids Deserve a Shot. So the state of Minnesota launched Kids Deserve a Shot, and that's an incentive program encouraging Minnesotans ages 12 to 17 to get fully vaccinated against COVID. Right now, only 50% of Minnesotans 12 to 15 and less than 60% of Minnesotans 16 to 17 are fully vaccinated, which is the lowest vaccination rates of all eligible age groups. So they're trying to get those numbers up. So this program consists of 2 sets of rewards for fully vaccinated 12 to 17-year-olds. So there's a $200 Visa gift card for 12 to 17-year-olds who start and complete their vaccine series over the next 6 weeks. And then there's going to be 5 weeks of drawings for a $100,000 Minnesota college scholarship and other Minnesota experiences for 12 to 17-year-olds who've completed their vaccine series at any point in 2021. So to register for that, you can go on that website that's up right now, and I'll share that again in the chat. And then hopefully we can also send that out to people via email so that everybody can get that. We would need to have a parent or a guardian fill out that form and register the 12 to 17-year-old. And anybody, again, 12 to 17 who starts and then completes that 2-dose COVID vaccine series, or if they get the J&J, that would just be the 1 dose, between October 18th and November 30th can register to receive that $200 Visa gift card. And then that registration will begin on November 9th. So you can register on November 9th, but it's anybody who completes that series of shots between October 18th and November 30th. And then, so with the scholarship drawing, that is eligible to all Minnesotans 12 to 17 who have completed their COVID-19 vaccine series. And the state of Minnesota will hold 5 drawings for a $100,000 scholarship, and that is to attend any public or private nonprofit educational institution in the state of Minnesota. And so for that, there's dates which will be on the website, and there will be deadlines on the website too. So for example, the first drawing will be on November 19th, and then the deadline for that is November 15th. So if you go to that website, you can check out all the kind of rules and all the regulations and the deadlines for these incentives. But the main takeaway is that if you have a 12 to 17-year-old and you're a parent or guardian, this is a really good opportunity to get them some incentive to get the vaccine, because they will get that, automatically get that $200 Visa gift card, and then also have a chance to win a really nice scholarship, a $100,000 scholarship. So I will put that again in the chat. And I think that's all for me. And hopefully I left plenty of time for questions.
Thank you, Jessica.
Mhm.
Okay, I am going to thank you to all our panelists for sharing that information with us. I think as I shared at the beginning, the purpose of our community forum tonight is to share information around the COVID-19 vaccines so that everyone has the chance to have the decision-making tools to make the best decision for themselves around the vaccine. And not only for themselves, but for their family and for their community. And we know how important it is for us to, when we have information that we want to share with our with our families, with our communities, we can support each other in making decisions around that. So it's important for us to be able to have the opportunity to hear from our local experts around the vaccine. So we're going to open it up for questions, and I see some questions in the chat, and there may be some questions in the audience. Let's see. One question from Mickey Etter is, can you clarify, are individuals having similar responses to boosters as to their prior vaccination, or was the pharmacist saying that the public in general is having similar side effects? I don't know if Lauren or Anthony want to address that.
If you guys have any questions in the audience, I think you have some cards you can write.
Sorry, I think I understood the bulk of that question. In general, or is the question just as people get boosters, are side effects similar to the ones they experienced during the initial shot?
Yeah, so are individuals having similar responses to boosters as to their prior vaccinations, or was it said that the public in general is having similar side effects?
So yes, most people will have somewhat similar side effects from my experience from their first shot. However, there is a chance that as you get more boosters and you have a stronger immune response, you will see more severe side effects.
Thank you. And there are some comments in the chat about the incentive program for children. And so I just want to pose the question to the panel. Why are kids, which some people might frame it as being bribed by taking the vaccine if it's so wonderful? So that's a question I think that has been floating around the chat, or that sentiment. So I don't know who wants to answer that question, but let's address that.
Yeah, I'll try that. We chatted up here to see who would take that question on. Yeah, that is not an uncommon sentiment, and I can understand that sentiment. Absolutely. The concept of incentivizing vaccination is controversial for sure, and everybody has their own. You really can make their own decisions as to whether they feel this is the right thing to do or not. For some people, it is. I've seen it myself in vaccine clinics. That are held by St. Louis County. I was there to support answering people's questions, and I saw people that decided, yeah, that would be an inducement for them to make a decision that they would ultimately get vaccinated. It wasn't that they didn't want to. It was they had been thinking about it, and they thought this might be the time to do it, as long as they had a little bit of extra money in their pocket. That's for them. For other people, it's not for them, and in fact, other people feel kind of strongly negatively about it. This has been the case around the country, and not just in Minnesota. These incentive programs are a bit controversial. And tonight we were asked by the Minnesota Department of Health if we could present that to the folks that are listening today, because it is a new incentive that's focused directly on children that they've just rolled out.
Grant? Another question in the chat is, can you please discuss the risk factors of the vaccine for children?
Hello, again, I'm Dr. Lundstrom. So the biggest focus of the FDA committee yesterday was about the adverse effects and the risk factors. And so what they found is that there are pretty mild adverse effects, like Anthony was saying, with the fatigue or headache for a couple days, some mild symptoms in that perspective. There has been shown a few cases too of something called myocarditis. I'm not sure if you've heard of that yet, on the news or anything like that, but it's basically inflammation of the heart. You can get that from viruses, from infection, from certain medications. Even mild medications like an ibuprofen, sometimes you react strongly to it. There have been some cases where they've shown that that's been linked with some people with the vaccine, but it's only been shown in a total worldwide 877 cases out of 100 million vaccines given. So it's extremely rare, and all of the cases were mild to moderate forms and they have recovered. So it's something to consider in terms of your child, but it's extremely rare, and there are risks with everything that we do and everything that we take. Driving a car, eating a cheeseburger, there's always risks. So it's up to you as a parent to decide if that's something you want to do.
You.
Mm-hmm. Yeah. Yeah. So in addition to COVID itself can actually cause inflammation of the heart. We've been calling it MIS-C for right now, but it's a mostly system inflammatory issue. And so it does cause pretty significant myocarditis as well as a multitude of other problems. I have personally seen children in the ICU in acute heart failure within a matter of days because of COVID. And there have been a few deaths from that. I think it's up to 2% now who have received that, have died, unfortunately, passed away from it. And there are quite a few children with chronic heart problems because of having gotten COVID. MIS-C is something that we're still working on, but it basically comes up as an inflammatory response 2 to 6 weeks after the child gets COVID. When I was working in Detroit during the peak of COVID season, the vast majority of these kids had 0 symptoms at all with COVID. And then 2 to 6 weeks later, they were in heart failure and they were being put on something called ECMO, which basically pumps the heart for you. So it's far, far more of a risk in terms of trying to, risk and see if your child gets COVID versus having the vaccine.
Mary Jo, I'm going to ask a
Yes.
follow-up for Dr.
Sure.
Lundstrom. So I also read the synopsis of the discussion that was had yesterday at this committee, and some of the discussion revolved around, it's complicated as time goes on and more people will become immune to the virus. There becomes less and less opportunity to get infected. There is this slight risk, but it is real, of the myocarditis. And so it was recommended that really the parent, this is a one very important time to have discussions with parents with their provider about what's best for their child. So some children may be more at risk for severe COVID. Maybe they have some underlying conditions. Could you talk about that? How would you talk to parents about that have 5 to 11-year-olds that are now considering whether or not they would want to get vaccinated based on these rare risks of myocarditis, but still with maybe underlying conditions, et cetera? What would you talk to them about?
So what I like to say to my patients is that I like to give them all of the information. I like to give them the negatives and the positives of things such as something new like this, the COVID vaccine. But what I would say for my kiddos is that it's up to the parent, but in terms of the risks of COVID, so we have found right now, the CDC reported that up to 42% may be immune, the 5 to 11-year-old group may be immune already, up to 42%. However, there's still 64% who are not immune. And like what he was saying before, you can have COVID, but then have breakthrough and get it again. And so it's not necessarily a foolproof natural immunity that you're gonna be, immune for life, right? And so what I would say to parents is that the risks and the things that I have seen in the hospital are much more severe and much more scary if you do have COVID and if you are one of those unlucky children to have a severe reaction versus the very few who have had reactions to the vaccine and who have turned out fine after. These children have not died. These children have, as far as we know, don't have any chronic issues from the vaccine. But when it comes to COVID and the severe reactions of COVID, that's a very different story. So.
Thank you for that follow-up, Grant, and thank you, Lauren, for that response. And there, I'm wondering in the chat, Danielle, you had shared some things in the chat, and I'm wondering if that gets to your what you're talking about. You want to unmute and talk, you can as well. Okay, so in the chat, Danielle shared, compare the rate of hospitalization for children to the rate of vaccine-related myocarditis. I'm not pronouncing that correctly. The FDA stated yesterday that the rate of hospitalization in the 5 to 11 age group is less than 10 out of a million. And myocarditis is expected to be about 115 million. Listening to the FDA, my takeaway was that they discussed at great length that voting no meant it would be available to no one. A yes vote meant too many kids who didn't need it would get it without the benefit of safety data. I don't know if the panelists, anyone wants to comment on that or reflect on that.
So it's important to know that this committee meeting yesterday, we want to get into the weeds on this a little bit, I don't want to get too far down that road, is the first step. So this was not an approval. There is additional steps that will be taken before this approval will be given for 5 to 11-year-olds. And I think what the person in the chat was referring to, I didn't catch all of that, is a very detailed, complicated question about modeling and risks of the rare cases of myocarditis with the mRNA vaccines to the myocarditis that Dr. Lundstrom was just talking about in hospitalization, other severe effects of children that get COVID-19. And those are rare. They're much more rare than we see in the older population. And it's not understood necessarily why children have generally less severe disease. They can get severe disease, especially if they have underlying conditions, versus adults. And the older you get, the more likely you are to have severe disease. It's not entirely clear yet biologically why that is the case, but we know that there's lots of things different about little people from big people, including how your immune response is developing. Some of that is good for little kids and some of it's bad for little kids. And so what this discussion that I think was being referred to on the chat yesterday has to do with modeling. And there's some uncertainty in the modeling. We don't actually know yet what the numbers or the percentages of children that get myocarditis from a vaccine. We know it's very low, but it's also very low that children develop really severe disease. And I think that's what the committee was discussing. But overall, their decision was that the benefits of the vaccine, all the models that they looked at, still outweighed the risks, the slight risks that are associated with severe adverse effects with the vaccine. Again, these are very, very rare. This myocarditis with mRNA vaccines is quite rare, but it has been associated. And that was the discussion that occurred yesterday. I think that was being referred to.
Nikki, you have a question. Your hand is raised.
Can I ask in person, even online?
Please.
So my question is really about how we think about data. I think Grant was just saying, there's challenges to modeling. And one of the challenges is that we're not all exactly the same human beings. So, when we start thinking about statistics, and Raymond Jobe did a nice job of explaining kind of in general what's happening with the disease. I think to a certain extent, we have to remember that we're also dealing with an epidemic, and there's a social component that has to be thought about as well. The risk we have in terms of our own health is one thing if we decide to get vaccinated or not, but it also affects other people. And so I just kind of wanted to add, it's not really a question, but add that, debating some of the statistics about the frequency of certain conditions also has to factor in, we have to think about ourselves as individuals. Some of us have more risk factors than others. So the data and the discussions about approving diseases, approving vaccinations and meta therapies, we also have to think about it from our own perspectives and where we fit into all these numbers. So I guess I'm repeating what Grant said about modeling, but just kind of making the point that the model reduces all of our individuality to just a generic human being. And so hopefully we can take a step back and think also about, what it means to be confronted by an epidemic or a pandemic, and what are our responsibilities as public beings to other people. So it's just asking the story about how we see ourselves in the data. Sorry, that was a long-winded, but it's another side, and I think a public health concern. So it's not just about us as individuals. Thanks.
Thank you, Mickey. Okay, in the chat, another kind of question around just the concern around safety, and that we won't know it until post-market surveillance. And so kind of the gist of the question comment is like, how do we know, or this person would like to know how our docs are being educated to utilize the safety programs, and what education will parents be given?
Try to give a shot at that one again. Kind of when I talked earlier, I talked about the VAERS. So it's just essentially the vaccine adverse event reporting system. So whenever, on any vaccine, anytime somebody gets a vaccine, there's a period of time afterwards. And really, if they have any adverse event, even if it can't be related to the vaccine, those events are tracked and documented. And this is no different for the COVID vaccine since we started last year. And those are continually going on. Some people can report small site injection events, again, such as itching, swelling, mild pain. Other people may choose to report headaches, diarrhea, GI, and then you get more severe, like or when they do seek medical help or have to miss work, or severe flu-like symptoms. So again, just using the Johnson & Johnson example, these vaccines, when they hit the market, it doesn't just stop there for their surveillance. It's every day, every dose that's given really is monitored in accordance with, different clinical trials that may be happening at time. I don't know if I hit the meat of that, so if you need to follow up, just let me know.
Keep an eye on the chat there to see if there's any follow-up. Thank you, Anthony.
Sure.
So we have 1 minute left, and we want to be mindful of everyone's time. So if there's things that we didn't answer that come through the chat, like I said before, we will follow up with the slides and make those available, as well as some FAQs around the key questions that were asked tonight. And so any other last comments by our panelists at all before we kind of close for the evening? So there is a follow-up in the chat real quick, wondering again just about the education to doctors on safety reporting, and that maybe Lauren could answer that as a pediatrician.
Yeah, and I was going to say, I saw that too, that question about education. As an educator, I'm always, it warms my heart to hear people wanting to have more education. And it is really hard. This pandemic is very hard for people to identify where to go to get good information that they can trust and that they can educate themselves on to make decisions. And I will turn it over to Lauren here in a second. I think one of the best places you can go is your pharmacists and your physicians, your public health nurses. These people have information that they can provide to you and are happy to do so. In addition, there are trusted sources that you can go to. Some people like to go to the CDC. Some people like to go to the Minnesota Department of Health. The St. Louis County COVID-19 page that Ray introduced us to is outstanding. The data that he shared is outstanding. It's some of the best in the entire state, maybe even the country. I'm not. There's no hyperbole there. It really is outstanding. So we're lucky as a county to have that. University of Minnesota has some good sites to find information. CIDRAP, Center for Infectious Disease Research and Policy, called CIDRAP, is a good site. And the Mayo Clinic. We all love the Mayo Clinic in Minnesota, I think. That's a really trusted source that you can go to for good information. But really the best information source, if you can do it, is your providers. And so I'll turn it over to Lauren for the last word on that.
Hello. So yes, I 100% agree with everything he's been saying. I think a great first step, if you have questions, especially with this ever-evolving COVID and COVID vaccines and the constant changes and questions, I think first and foremost, your pediatrician is a great opportunity to kind of answer those questions. If we don't have the answer for you because it's too new or unknown, we certainly can do our due diligence and our research to get back with those questions and answered for them. I personally really enjoy the CDC website. It's very user-friendly. It's very well-spoken in terms of what the information you need and what you can find. They have information of all vaccines, not just this. And in terms of further safety education and further side effect education, CDC is constantly updating that, as well as all vaccines that we give to our children. And then in terms of you deciding if you want your child to get the vaccine or not, I'd highly encourage you talking to your doctor. They are the ones that know your child personally, and they know exactly what the medical history is. And oftentimes your pediatrician is with you from when your child is a little baby. And so I think they are a great resource for you to kind of decide a final decision on where you're going to go with this vaccine.
Thank you, Lauren. So thank you to our panelists for all the great information they shared tonight. And I think hopefully the things that you heard sparked you to either ask more questions, like Grant and Lauren said, to your local resources, so to your pharmacist, to your healthcare providers, to that pediatrician that you have spent the last many years with, perhaps in your family. And so reach out and ask more questions and get those pieces that you might not quite understand yet, or that we might not be able to understand just as a society around the virus, but some of those other resources and some of those other questions that can be answered by our local experts. So I really encourage you to reach out and have those conversations. And please, if there's any follow-up questions, you can reach out to us to ask those. We will, like I said, share the slides, but we really want to just make sure that everyone has the information they need to make, like I said, the informed decision for themselves, their family, and then as Mickey shared, for the effects on the community, that the communities that we live in as well. So thank you again, everyone, for attending and for putting up with this hybrid approach as we're doing it in person and online. And so thank you so much and have a good evening.